Endometriosis is the presence of cells from the inner lining of the womb, called the endometrium, outside the uterus. So basically, cells which line the inner lining, which is normally responsible for pregnancy and implantation, they are in the abnormal position, which means that they land outside in the pelvis, and they may be affecting nearby structures in the pelvis, such as your ligaments, your ovaries, and even your nerves. So what happens in endometriosis is these cells, which normally bleed and have the menses and create the menses, when they are in the abnormal position, they also tend to bleed and cause inflammation by the release of chemicals, and the chemicals will cause pain, right? Stimulation of your nerve endings, and in some severe cases can actually invade deeper and affect other structures such as the rectum, or even the bladder, or even the ureter. So what causes endometriosis? The most common theory is that of backward menstruation, which is called retrograde menstruation. Scientists believe that when the cells fall backwards through the tubes into the pelvis, these cells can actually implant in the pelvis, and then they can grow and what you call proliferate, and then this can cause further inflammation and scarring. Of course, other factors may come into play, such as genetics, immune factors, or even so-called bacterial infection that may cause easier implantation of these endometriotic lesions. One of the most common symptoms of endometriosis is menstrual pain. Now, it is acceptable if there's some usual mild cramping, but when it's painful to the point where it actually disrupts the patient's quality of life, then that is significant. So what do I mean by disruption of quality of life? If someone has got to take painkillers on a regular basis, if during the menses she is so badly affected that she has got to lie in bed and double up and crouched up, then it is significant. And if say you have to take medical leave from either school or work, that is also a significant point to take note of. So in addition to pain, some patients might experience other symptoms such as giddiness, cold sweat, nausea, vomiting, and some even have what you call bowel symptoms. They may feel like they have this urge to go and pass motion during the time when they have the menstruation and the pain. This is because of the rectum that is affected and the nearby ligaments that are infiltrated with endometriosis.